For many individuals, kidney stones may recur despite increased fluid intake and dietary modifications. What's often recommended for these patients is medical therapy with Urocit-K extended-release potassium citrate. In fact, clinical studies have shown that Urocit-K can reduce kidney stone recurrence in 90 to 95% of patients. To effectively inhibit stone formation, the therapeutic goal for most stone formers is to maintain urinary citrate above 500 milligrams per day, or as close to 640 milligrams per day as possible, and to increase urinary pH to between 6.0 and 6.5. What is your dosing strategy for recurrent kidney stone patients? It's been established that 60 milliequivalents of Urocit-K potassium citrate will raise urinary citrate by approximately 400 milligrams per day and raise urinary pH by approximately 0.7 units. Optimal dosing of Urocit-K 15 milliequivalents potassium citrate is based on the underlying cause of stone formation, which varies from patient to patient. Dosing can range from as low as 30 milliequivalents per day to as high as 60 milliequivalents per day, depending on the urine chemistry values. Baseline lab values are recommended to pinpoint the underlying cause and indicate the proper starting dose for maximizing therapeutic effectiveness and achieving the best possible patient outcomes. And now, the newest dosage strength of Urocit-K, containing 15 milliequivalents of potassium citrate, is available to simplify dosing, offering important advantages for patient therapy. Because adherence to the regimen you prescribe is the best protection to help guard against stone recurrence. With 50% more active ingredient than 10 milliequivalents of potassium citrate, Urocit-K 15 milliequivalents helps achieve and maintain therapeutic goals and offers your patients the convenience of fewer tablets per day. Studies show that simpler, less frequent dosing regimens demonstrate better patient compliance, and that means less risk of another stone attack for your patients. Urocit-K 15 milliequivalents of potassium citrate is also very affordable for patients with drug coverage. In many cases, filling a prescription requires a patient copay of only $10 to $15, which is comparable to the cost of generic 10 milliequivalents of potassium citrate. And with the savings card worth up to $40 per prescription, which can be used up to 12 times, even patients with less generous coverage plans will pay an average of less than $20 out of pocket to get the prescription filled. With dietary changes and proper Urocit-K 15 milliequivalents potassium citrate dosing, you can significantly reduce recurrent stone formation and reduce painful episodes of stone passage. So prescribe Urocit-K 15 milliequivalents potassium citrate for your patients who may be more responsive to a higher strength of potassium citrate, may be more compliant with fewer tablets per day, and will appreciate the affordability of this therapy. For more information about Urocit-K 15 milliequivalents potassium citrate or to order patient sample kits, go to urocit-k.com or call Mission Pharmacol customer service at 1-800-531-3333. Urocit-K is contraindicated in patients with hyperkalemia, peptic ulcer disease, active urinary tract infection, and renal insufficiency, and those patients who have conditions predisposing them to hyperkalemia, including chronic renal failure, uncontrolled diabetes mellitus, acute dehydration, strenuous physical exercise in unconditioned individuals, adrenal insufficiency, and extensive tissue breakdown. Patients with impaired mechanisms of excreting potassium should be closely monitored for signs of hyperkalemia with periodic blood tests and ECGs.